says 339. $340. Okay, so for this part of the assessment, we are going to inspect and listen to your lungs, heart, and abdomen. So first, for your thorax, you just pull your shirt up. So the anterior thorax is flat. There's no pulsations noted. It's round. Color is pink. The respiratory pattern is unlabored and even. The chest is symmetrical, so we'll look at the back. Back is the same. So next we are going to check for thoracic expansion. I'm going to stand behind you and make a W with my hands and just have you breathe in and out. Okay, take some breath. So my hands move evenly as you breathe in and out, so that is normal. And the anterior and posterior section is larger than the thoracic section, and that's within normal limits. So next, I'm just going to feel here. Any pain?
No, ma'am.
So there's no bulges, masses, no lesions noted, just some normal male pattern hair distribution. So next, I'm going to hold my hands on your back like this, and every time you feel me move my hands, say 99.
99, 99, 99, 99, 99.
Okay, so tactile fremitus was noted on both ulnar surfaces of my hands, and that's within normal limits. So next, we are going to percuss your lung fields. So it is resonant in the anterior. And the posterior side. So next we are going to palpate or percuss for diaphragmatic excursion, or I'm going to make some little X's on your back and measure. So you can just lean forward and take a deep breath in and hold it. Okay, and breathe normal. And then take a deep breath out and hold it. Okay, then you can breathe. So yours is about 4 centimeters and 3 to 5 is normal. So diaphragmatic excursion is within normal limits. So next we are going to listen to your lung fields anteriorly and posteriorly. I left the stethoscope in the other room. Breath in and out. lung fields are clear bilaterally, and breath sounds are equal on both sides. So next we are going to inspect your chest, which we already sort of did. You can pull your shirt up one more time. There's no heaves, lifts, or thrusts noted, no pulsations. So next I'm going to feel for the point of maximum impulse. So the apical pulse feels regular, not fast. So next we are going to listen to your heart, all the different places. Both the diaphragm and the bell. So the aortic is the second intercostal space, right sternal border. Pulmonic is the second intercostal space, left sternal border. Erb's point is third intercostal space, left sternal border. Tricuspid is the fourth and fifth intercostal space, left sternal border. And mitral is the fifth intercostal space, mid-clavicular line. And then all those with the bell. So heart rate is regular and no murmurs were heard. So next we're going to do your pulses. So temporal, radial, and brachial. And then lower extremity is popliteal, which is behind the knee. The posterior tibial, which is on the inner aspect of the ankle, and the dorsalis pedis, which is on top of the foot. And all of the pulses are strong and bounding. So next, we are going to do your abdomen. So if you lay down. So skin on your abdomen. There's some normal male pattern hair distribution. There's no striae or vascular patterns, no umbilical hernias. The umbilicus is small and midline to the abdomen. There's no bulges or masses. So next we are going to listen to the bowel sounds and your arteries. And we would do that with the diaphragm and the bell. So everything we've done today will be on both sides, assuming that the body is symmetrical, but we're not going to do it on both sides for this assessment. So the arteries is the renal, iliac, and femoral. So bowel sounds were heard in all of the quadrants. There was no hums or bruise over the arteries and no friction rub over any of the organs. So next we are going to percuss the abdomen, 3 places in each quadrant. And percussion is dull, and that is normal. So next we are going to percuss and measure the liver. So I'm going to make another line on you. So you can just breathe normal. Yours measures at 9, and between 9 and 12 is normal. So next we are going to percuss the spleen. Any pain?
No, ma'am.
Good. So next we are going to palpate the liver, lightly first and then deeper palpation.
No, ma'am.
And the spleen. We'll take another breath. So the spleen was not palpated and there was no bulges or masses noted when palpating the liver. So the spleen was not palpated and that is normal. So next we will palpate the kidneys. So take another breath in and out. In and out. So the kidneys are palpated. Any pain with that?
No, ma'am.
Okay, so no bulges, masses, or lesions noted with the kidneys. So we are going to scan this room real quick and then we'll do a musculoskeletal exam. Okay. So, for this exam, you can sit up on the side of the bed first. So, in looking at you, the alignment of your muscles and bones is symmetrical, contour is round, symmetrical on both sides. So, I'm just going to look at your arms, hands, wrists, elbows, shoulders, hips, knees, ankles, feet, toes, and fingers and hands. So the bones and muscles of all of these mentioned joints are symmetrical bilaterally. So next we're going to do some exercises. We're going to start with your neck. So we're going to do range of motion, and then we're going to do everything twice, and the second time I'm going to put resistance on you and see the strength of the joints. So for your neck, we're going to do flexion. Do what I do. Just flexion, extension, hyperextension, right, left, it's lateral, and then around. Okay, so then come towards me, away from me, extension, and then side, laterally. Okay, so the neck is intact. Next we're going to do the shoulders. So we're going to do flexion, extension, and then hands behind you, hyperextension, and then away from you is adduction, and towards you is adduction. So the strength of that is going to be putting your arms up. So extension, do it again. Flexion, extension, and then try to go out, and then back in towards me. Okay, so that strength of those joints is intact. So next we're going to do the elbows. So flexion, extension, and you can't hyperextend the elbows, so you do pronation and supination. So then same thing again, flexion, extension, and then the rest is the same as the shoulders, which we just did. So next will be the wrists, hands, and fingers. So spread your fingers apart, make a fist, thumb to your fingertips, bend your fingers up and down, and then bend your hand up and down, flexion and extension. Turn your hand to the right, which is radial deviation, and the left is ulnar deviation. So next we're going to do flexion. So of your wrist, put your hands up, put them down, extension. So squeeze my fingers to assess the grip. Squeeze my fingers with your whole hand. Okay, so grip is intact bilaterally, and then we're going to do the same thing with your fingers. So put your fingers up, flexion, down, extension, spread your fingers out, and then close them. Try to spread them out again. Hold them together, don't let me open them. So your strength is intact for your wrist and your fingers and your hands. So next is the hip. So So if you can lay down flat. So raise your leg, your knee straight and back down, and then put your knee to your chest. And then swing your leg out to the right and left while it's straight. Okay, and then do internal rotation, which is this. And then external rotation is put your knees together and your foot out this way. Perfect. So all of the range of motion in your hips is intact. So now to do the strength, I'm going to have you push your leg up and then down and then stand up and swing your leg behind you. You can face this whichever way. So that is intact. You can move your leg forwards and backwards. And then if you can sit back on the table to test your hamstrings, gluteal muscle, your abductor and adductor, you can cross your legs. And then the other one. Perfect. So next we're going to do the knee, so you can sit. And then you flex your knee, bring it out, and then put it back. And then out again to strength, and back. So the knee range of motion and strength is intact. Next we will do the ankles and the feet. So if you can point your ankles, then you can lay down for this one. So point your ankles to the ceiling, to the floor. Bend your foot at your ankle like you're doing. Move the side of the foot to your right and then back down to the floor. That's inversion and eversion, and then rotate your ankles in a circle. So the range of motion is intact in the ankles. So for the strength, I'm going to have you push against me and then pull back up. So flexion and extension in the foot is good. Next we are going to do your upper spine, your thoracic and lumbar spine. So if you want to stand up, you're going to get your exercise. So if you stand up and you go forward, flexion, stand up straight, extension, and back is hyperextension. And then touch your toes. And I'm going to stand behind you and look at your spine for scoliosis. And then come up. So the spine is straight, no scoliosis is noted. So now we are going to test your gait. So move the camera over a little bit. Okay, so I'm going to have you walk towards me using a heel to toe gait. And then walk away from me using the same gait. Okay, so the patient is walking in a heel to toe gait and is not stumbling around or falling around, so that is intact. So next, I want you to close your eyes and put your feet about shoulder lengths apart. This is the Romberg's test and the heel to toe gait, and this one is testing cerebral function. So with your eyes closed, I'm going to bump your shoulder. Okay, so the Romberg's test is negative. The patient is not swaying back and forth or losing their balance when they're standing with their eyes closed. You can open your eyes now. So next, we are going to do the cerebellar function, and you can sit back down for this one. And we're going to do rapid alternating movements of your hands, so just put them forth and back as fast as you can. Good. So next we are going to do the finger to your nose test. So do what I do, put your nose on your finger and then point your hand that way and then switch back and forth. Okay, and so next is sterignosis, and that's going to be, I'm going to give you an object while your eyes are closed, and I want you to tell me what it is. Okay, so close your eyes, open your hands, tell me what it is.
Safety pin.
Okay, thank you. And so now I'm going to write a number on your hands while your eyes are closed, and I want you to tell me what number I write, okay? So what was your hand?
Number 2.
Okay, so the first one with the object is stereognosis, and the second one with the number is graphesthesia. So next we're going to check sensory function, and this is going to be light, touch, and pain. So this Q-tip is soft, and this safety pin is pain. So I want you to tell me which one it is. I'm going to touch 3 different places and tell me if it's pain or soft. So close your eyes.
Soft. Pain. Soft.
Do it again.
Soft.
Okay, so we would do that bilaterally again, but did great with that one. So next we're going to do position sense. So I'm going to take a finger and a toe, and with your eyes closed, this is up, this is neutral, and this is down. So close your eyes, and I'm going to do different directions and tell me which direction it is.
Up. Down. Neutral.
Okay, so position sense on the hand is intact, and we do the same thing with the toe.
Up. Down. Neutral.
Okay, so position sense on the lower extremities is intact. Next we're going to do vibration sense. So I'm going to take this tuning fork, and I'm going to put it on your wrist bone and then your ankle bone, and I want you to tell me when you can feel it stop vibrating.
Stop.
Okay. Same thing with your ankle.
Stop.
Okay, so vibration sense is intact on the upper extremities and the lower extremities. Next, we are going to check your reflexes. So, first one is going to be your biceps reflex. So,
What's going to happen?
your arm's going to jerk, and I'm going to hit my finger, and your arm has to relax. Yeah. Okay, so the biceps reflex is intact. So next we are going to do the brachioradialis. And so it's going to be right here. So just let your arm relax. So the brachioradialis is intact. Next we are going to do the triceps, and that's going to be on the back of your elbow. So relax your arm. So the triceps reflex is intact. Next we're going to do your patellar, which is your knee. So when I do this, hold your arms like this. Try to pull your arms apart and count backwards from 10.
10, 9, 8, 7.
Okay, so the patellar reflex is intact. And next we are going to do the ankle jerk. So this is your Achilles tendon. I'm just going to hit it with this as well, and your foot should jerk. Okay, so the ankle jerk is intact. So this completes our assessment. Thank you for your participation.
Thank you.